All right, we're back again with Dr. Ray Cahill of SeaPort Veterinary Hospital on Eastern Ave in Gloucester. Thanks for joining us again, Ray. How you doing?
I'm all right. Thanks for reaching out again, Corey. It's awesome. You guys have been, like I said, you've been going gangbusters. So good job. Community needs you, man.
We talked to everybody.
Yeah, I know. Well, so Ray, so I guess it's been a while since we chatted, and a lot has happened. I know you were doing basically an animal hospital's version of curbside pickup, with people dropping patients off. How is the practice functioning these days?
We're functioning. We've had to, other than the medical side of things, like our protocols, we've really had to reinvent the wheel. So it's taken a lot, and the staff's incredible. They come up with great ideas on how we can adapt. They've been very adaptable. Where we are right now is we're still required just to see sick animals, anything that's medically essential. So anything that's sick or anything that needs a rabies vaccine, because that has very important public health implications for pets and for people, that they be maintained with their rabies vaccine, of course. So about 1/3, there are 15 of us that work at the hospital, and a third of the people are working from home due to high-risk situations. And the remaining 10, we're now divided into 2 teams of 5. So we have 5 people in the hospital for 2 weeks while the other team of 5 is home. And then we're going to be swapping out at the 2-week marks. So we always have one team of doctor and technicians and reception who are at home at the ready. So if one team does happen to get sick, they can go home and be in quarantine for 2 weeks, but the other team can step in and keep the hospital running during that time. So we think that's we can't offer as many appointments as we normally do, of course, but at least that's the best way to keep the hospital running. It's the best contingency plan we can come up with. So that's where we are right now.
I'm sorry, Heather.
I'm sorry, Corey. Has everybody been well in your practice, right?
Everybody's been well. You get the occasional scare. You get a sinus infection or allergies are flaring up, and you don't know. But of those that have gone and get tested, I actually had to get tested at one point, so it's been negative across the board. But everyone's been in good shape, so fingers crossed.
Yeah. And now that we're into the second month of this how have your clients responded?
Pretty much awesome. The client response has been awesome. Sometimes you find yourself explaining why you can't just do a nail trim. Everyone's situation is a little bit different. It's one of those moments where you're called on to, dig deep and really put on that compassion hat, because that nail trim might mean a big deal to somebody. But the client response has been tremendous. People showing up with masks on, which is great, really adapting to the protocols. And so we're grateful for that. So that really helps.
Excuse me, Corey, could you talk to us about this new news that animals may be able to contract COVID-19?
Sure. There's a number of cases, and I guess we should just get it right out there to say that there's, although there are cases of pets testing positive for COVID-19, there's still no evidence of transmission between pets and people. That would be the nightmare scenario. My gosh. So we're in good shape on that front. But yes, there's been, between those large cats at the Bronx Zoo, there was that Pomeranian dog in Hong Kong. There was a couple of cats in the United States, a cat in Belgium. Most recently, there's this pug, this cute little guy, Winston, down in North Carolina, who got some respiratory symptoms. Imagine a pug with respiratory symptoms.
That's what they have.
Right, insult to injury, right? So, and these animals tested, positive for the coronavirus, for C19. And so So the assumption there is that they were developing symptoms in response to those infections. So, you know, we kind of joke and say we look through the lens of the pets should be almost afraid of us as opposed to the other way around. So yeah, so there's a growing, it's a very small body of cases, but there's some growing information that this can set up shop in some pets on rare occasions. And then what do we do about that? Our governing body in the United States, the AVMA, American Veterinary Medical Association, they've been tremendous through this. Guidelines and recommendations and educational resources for veterinarians and for the public. They've there are two recommendations right now, which are very common sense based. One is that if you do have coronavirus, probably a good idea to, this is a big one, but if you can limit your exposure to your pet, I mean, good luck with that one. It would be probably the best case scenario, so that they don't pick up symptoms, or if there's any remote chance that they might carry it to another family member. So that's one of the recommendations.
The assumption is the animals are contracting the virus from humans.
Yes.
Right. Yeah. And no evidence of the other way around, which, as you mentioned at the beginning, that's great.
Right.
Right.
Correct. And then the other recommendation was, if you have a cat that goes outdoors, knowing that a lot of cats kind of lead these double lives, they have more than one family sometimes, wouldn't be the worst idea that if you have, you know, coronavirus, maybe keep that cat indoors during your isolation period, just so that it doesn't have the chance to get out and potentially go into another household. And there you go.
On cue.
You're right. Even invite her up.
But Ray, what happens now as the months get warmer, flea and tick season kicks in? How are we going to be able to accommodate clients moving forward?
You know, we love that people are out and about. That's great. It's just good on so many levels. You know, the ticks have taken over the planet. This is their planet now. And we get endless calls all day for, you know, flea and tick and heartworm preventatives. So, which is good. I mean, we expect that during the springtime. So we have, our system is very well able to handle those requests. One of the folks that is working remotely right now, all the pharmacy calls for refills, they're filtered immediately to her. And she's fully plugged in with her technology into the hospital from home. So, you know, so she's able to just verify in the files that they're due for what they're due for the preventatives. And then from home, she, you know, sends through the prescription label right into our facility. And we let them know, give them a ballpark of when it's going to be available. And we have a pickup bin right on our ramp out front. We open a window and we put the medication right out the window into this pickup bin for folks, so they don't have to, you know, come into the building. So that's a pretty easy one. Yeah.
So any message for clients of the community before we let you go and get back to work?
You know, it's been pretty impressive how the community has responded, and it's nice. It speaks to such a stressful time this is, but it speaks to the happier, more positive side of what's going on right now. You've got people making masks. Oh my gosh, how innovative is that? You've got, you know, what Ryan and Wood making hand sanitizer. You know, we've got people adopting pets in record numbers right now. So there's such a grit and character in this community that's just showing how we can, and we need to just rise above this sense of anxiety and fear that's kind of getting a grip on the world right now. So I think just taking, I just want to tip my hat to that and say, you know, I'm certainly going to focus on it, and I think it's great to maybe try to take some time and appreciate all that awesomeness that's going on out there in this community. This is such a great place to be up here in Gloucester. So I just wanted to throw that out there.
Well said. All right. Well, thanks for your time, Dr. Cahill. And we'd love to follow up soon. And hopefully it'll be business as usual at some point, or as
Maybe.
unusual. I don't know.
Maybe.
Yeah.
All right. Thanks for reaching out. Stay well.
Take care. All right.
Thank you.